This is a modified mind map presented by Miriam, Ashley, and Kirsten. Looking at case study 1, Mr. WM has recently suffered a right CVA and is an 82-year-old male who is married to his wife of 63 years. Previous to admission, he was completely independent and had been responsible for taking care of his 50-year-old son, who was in a serious car accident 3 months previously, and who now requires constant care with BADLs. Mr. WM is a retired carpenter. His wife has osteoporosis and cannot help their son with heavy ADLs. The patient is confused and often asks where his wife is. He also has another son, aged 53, who lives in the community. His leisure interests include golf, woodworking, playing cards, and walking around the neighborhood. The two types of strokes include ischemic, which is when a blood clot develops at the vessel and at another location, and hemorrhagic, which is when a weakened vessel that ruptures and bleeds in the surrounding brain. Some warning signs of stroke include sudden numbness and weakness in the face, arm, or leg, especially on one side of the body, confusion or trouble speaking or understanding speech, vision problems, difficulty walking or dizziness, and severe headache. A common concern with a right CVA specifically is impaired alertness and decreased safety awareness. We determine Mr. WM's prognosis to be between fair and poor due to risk factors such as age and condition, being that he has minimal voluntary movement in his left upper extremity. Some strengths of Mr. WM are that his right side manual muscle testing and range of motion are within functional limits. He is oriented to time and self, he has good family support, and he has multiple leisure interests. While some weaknesses are that he currently lives in a 2-story home with multiple steps to get inside and his bedroom being on the 2nd floor. His age, he is confused and unoriented to place, can be physically impulsive, shows moderate signs of depression, has hypertension, and has poor sitting balance. Two quick screens we could give to Mr. WM are the Comprehensive Trail Making Test and the Lowenstein Occupational Therapy Cognitive Assessment, or LOTCA. The Comprehensive Trail Making Test assesses problems with psychomotor speed, visual search and sequencing, and attention. The LOTCA assesses basic cognitive and visual perception skills, as upon evaluation, Mr. WM shows moderate neglect of left visual field and confusion to place. Three evaluations we would administer to Mr. WM are the Modified Ashworth Scale, the Motor-Free Visual Perceptual Test, and the Fugel-Meyer. The Modified Ashworth Scale gathers information on muscle tone and spasticity. The Motor-Free Visual Perceptual Test measures visual perceptual skills in 5 areas, which include spatial relationships, figure-ground discrimination, visual closure, and visual memory. And the Fugel-Meyer assesses motor functioning, balance, sensation, and joint functioning in patients with post-stroke hemiplegia.
To address Mr. WM's goals, we wanted to incorporate ADL performance while also making each treatment session meaningful to him and his occupations. With that being said, his first long-term goal was client will perform a self-feeding task during a mealtime with modified independence using a plate guard to increase independence by discharge in 4 weeks. The short-term goal to go along with that was client will complete a 30-minute card game with no breaks in a seated position to address static sitting balance and endurance with modified assistance within 2 weeks. The hope is that at the end of the session, he'll be able to perform a self-feeding task during mealtime, which could be approximately 30 minutes in length. As of right now, his endurance is only 15 to 20 minutes before he needs a break. So the hope is that practicing card games with no breaks will help him and his feeding during mealtime. Mr. WM's second long-term goal was Client will perform donning and doffing a t-shirt using right upper extremity to increase independence in ADLs with standby assist by discharge in 4 weeks. The short-term goal to go along with that was client will identify objects in left visual field 4 out of 5 times to address visual neglect with 3 or less verbal cues within 1 week. The hope is that in his short-term goal with practicing his visual neglect, he can implement looking at his left side and acknowledging it while he does his donning and doffing of a t-shirt. A t-shirt is also a good option because it's loose and baggy and makes dressing easier. An important intervention to note is patient and family education. This is vital for Mr. WM and his family so they can better understand the side effects of a right CVA as well as how to prevent a future CVA from occurring. Additionally, it is important to keep the family and Mr. WM up to date on next steps of care. A compensatory approach would be appropriate. This would allow him to look to the right each time a visitor came. This may also be important for placing photos of his family in a whiteboard to keep up to date with mealtimes and schedules. The edema in his left hand is also something that should be addressed. Patient education on raising his arm above his heart and also compression are important steps to be included in OT sessions. Introducing the Calm app to Mr. WM would also be an intervention that could positively impact his depression. This may also help with anxiety of being away from his wife and his family. And it can be implemented on a smartphone or an iPad, which can be stored in his room. Because Mr. WM loves woodworking and playing cards, the next 2 interventions would be beneficial for him. Playing a game of solitaire and building a birdhouse would allow Mr. WM to use his left side as well as his right side. Placing cards or pieces to the birdhouse on the left side would require him to use both the left and the right. It may also be enjoyable for him, so he may be wanting to participate in these activities for longer, which could also help with his endurance. Introducing a sock aid may be a cheap alternative for Mr. WM to feel more independent when completing his ADL tasks. Playing a game of golf would also be in tune with Mr. WM's interests. Although this is virtual, it may be beneficial to have the Wii set up in his room so that he could play with family members or staff if they came to visit. It also would give him the idea that he is on a golf course instead of in an inpatient facility, which may help with his depression. Grooming education may also play a role in Mr. WM's ADL performance. Starting off with a grooming task may allow Mr. WM to feel more independent. Introducing an electric razor may also allow him to complete the task, as this requires less time and less energy from Mr. WM. Lastly, playing a game of bingo may allow Mr. WM to let loose and leave his room to interact with others. This may help with his depression while also allowing him to play games like he loves to do.
In addition to interventions, app interventions may also be used to benefit and correspond with the various aspects of an individual's condition. One app that could be utilized as an intervention for Mr. WM is Visual Attention Light. This app is used to help individuals who have had a CVA to improve their scanning abilities, assess for neglect, effective therapy for attention deficits, practices scanning from left to right to help retrain the brain to move eyes correctly, improves reading, concentration, memory, attention to detail, and speed of processing. This app also helps rehabilitation professionals to assess for neglect and provide more efficient and effective therapy for attention deficits. This app would be beneficial for Mr. WM to address his moderate visual neglect on his left side. Active range of motion, manual muscle testing, and sensation were all unable to be tested during his initial evaluation due to his neglect. This app would help to improve his ability to scan for words, letters, numbers, and objects to retrain the brain to move the eyes correctly. Improvement of his left visual neglect would assist in improvement in his ability to participate in range of motion, manual muscle testing, sensation, and other ADL and IADL tasks. This app has a 4.9 star rating on the App Store and is free. The next app that could be beneficial for Mr. WM is the Calm app. This app can be used for sleep, meditation, relaxation, better sleep, lower stress, less anxiety, relaxing muscles, and meditation sessions for various lengths of time to fit with the schedule, and it also checks in to see how you are feeling and has daily Calm check-ins. This app would be beneficial for Mr. WM as he has recently had a stroke, and this is causing there to be many alterations and changes within his life. He is displaying moderate signs of depression, and this app could help to check in throughout the day on his mood and could be used to help lower his stress. There are many techniques and options on this app that could help address his depression in a variety of ways. This app has a 4.8 star rating on the App Store and is also free. The final app recommendation for Mr. WM is the Smart BP app. The Smart BP app is an app used for individuals with CVA. This app can help prevent a second CVA, manage blood pressure measurements, tracks blood pressure progress, records, tracks, and analyzes blood pressure, and improvement for overall goals to improve blood pressure. Mr. WM has hypertension. This app could be beneficial to use to help keep him on track with monitoring his blood pressure status and measurements at various times throughout the day. This app could be used in conjunction with patient education to ensure that he understands the measurements of a healthy blood pressure and can start to notice warning signs. This would also help to prevent him from having another stroke. This app has a 4.3 star rating on the App Store and is free. Moving on to the treatment plan for Mr. WM would include a 1-hour occupational therapy treatment session. This treatment session is being held from 8 to 9 a.m. Mr. WM has poor endurance in the afternoon while his endurance is fair in the morning, and he requires one rest break after 15 to 20 minutes of therapy. Having the treatment session in the morning instead of the afternoon would be beneficial for him due to his endurance fluctuation throughout the day. Some areas of focus within the treatment session would be based upon improving trunk stability, addressing his confusion and depression, addressing his visual inattention, and addressing the lack of his left upper extremity movement and awareness of his left upper extremity. The first 10 minutes of the treatment session, so from 8 to 8:10, would be transferring Mr. WM from a supine to sitting position. This would help improve his bed mobility and to be seated in a seated position to participate in ADL and IADLs. The next 20 minutes of the treatment session, from 8:10 to 8:30, would be completing grooming tasks while in a seated position using a bedside table. The grooming tasks that would be addressed include brushing teeth, washing face, combing hair, and shaving face. Each of these ADL tasks would have about 5 minutes each to complete. The next 15 minutes of the treatment session, from 8:30 to 8:45, would be playing his favorite card game. This would be completed in a seated position and would help to address his dynamic sitting balance. This task would involve him having to reach and grab and place cards while working on trunk control in a seated position and reaching. Playing a card game was selected as well because of his leisure and interest that he has in playing cards to help engage him in the task. This activity could be done with other individuals or with him and the therapist. The final 15 minutes of the treatment session, from 8:45 to 9 o'clock, would be playing a game of Wii Golf. This is addressing bilateral upper extremity movement, and this activity could also address his visual neglect by having him look at the screen that is being utilized to play the Wii Golf game. This is also another leisure and interest to help engage him in the activity. For the next steps and discharge plans, we previously mentioned that Mr. WM has a fair to poor prognosis. Discharge plans should begin at the initial evaluation. Mr. WM should be re-evaluated in 1 month to assess his overall progress and ability to reach his goals within the inpatient rehabilitation facility. From here, the potential discharge site for Mr. WM is a skilled nursing facility. This would be due to his prognosis, age, and best suited given his situation at home.